Mr. Godfrey. How are you doing today?
I'm doing well. How are you?
I'm good. My name is Teresa Chigoke. I'm a student nurse practitioner, and I'm here to do a complete head-to-toe assessment on you. Is that okay?
Yes.
Okay. Can you tell me your name and date of birth, please?
Godfrey, date of birth October
25.
4th, 1986.
Okay. How do you feel today?
I feel well.
Okay. Patient's name is Godfrey, a black male. He's pleasant, communicates effectively. Mood matches the affect. He states that his mood is good. He's alert and oriented to person, place, and time. And the procedure has been explained to the patient. All right, like I said, I'm going to do a total head-to-toe assessment on you. And first, I'm going to start with the skin, okay? I've washed my hand. And, okay, looking at your skin is intact, smooth and warm to touch, no lesions, no edema, there is no scars, no tattoos, and everything. I'm going to check the skin to-go. Skin to-go is with instant recoil. Now I'm going to check your nails, inspecting your nails and the leg. Okay. Nails is intact, adhered to the nail bed, no cyanosis, no pitting, and nail angle is attached at 160 degrees. It's symmetrical. Checking your capillary refills. Okay, I'm going to check your tools. Capillary refills is less than 2 seconds bilateral, upper and lower extremities. Okay, next I'm going to inspect the hair and your scalp, okay? Inspecting the hair. Hair is evenly distributed, no inflammations, no lesions, palpating the scalp. There's no masses or any lesions. There's no tenderness. Okay, next, I'm going to check in on the head. Head is normocephalic, it's midline, no tremors, no thick, there's no deviation. Facial features intact and it's symmetrical, bilateral. I'm going to check on the trachea. Trachea is midline, there's no neck fullness, no thyromegaly. I'm going to give you water to drink so I can check your thyroid. Swallow. Thyroid rises as patient swallows. I'm going to palpate the thyroid. Checking on carotid pulse. Checking on the right one. I'm going to listen with Bruits for thyroid and carotid pulse. Carotid pulse. Thyroid. Thyroid and carotid pulse, there is no Bruits. Carotid pulse is 2+/4 bilateral. There's no Bruits. Now, the next one I'm going to check on the lymph nodes. I'll start from occipital, preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical. Can you shrug your shoulder? Supraclavicular. Can you cross your hand for me? Epitopial. And now I'm going to wear my gloves to check on the axillary. Okay. Lymph node is non-palpable and non-tender bilaterally. Next, I'm going to check on the eyes. And with the eye test, we do 2 eye tests. We have the Snellen chart and the Rosenberg chart. The Snellen chart, we used to check for a patient. We have it 20 feet away from the patient, and then we'll ask them to read what they can see. And the Rosenberg, it's used to, we'll give it to the patient to check, to read on the closest number they can see. And we'll read it. Right now, we're going to do the Rosenberg chart. I will have you read, closing your right eye. You can read.
4, 2, 5, 6, 7, 3, 9.
Thank you. You want to close and read with the other one?
4, 2, 6, 7, 3, 9.
Okay, and I'm going to have you read with both eyes.
4, 2, 8, 7, 3, 9.
Okay. OU, AD is intact. OU is 2020, OS 2020, OD is 2020, bilateral. Okay, next I'm going to turn off the light so that we can I'm going to inspect the eyes. Eye is symmetrical, bilateral. The eyelashes and the eyebrows are evenly distributed. I'm going to palpate. The lacrimal apparatus, lacrimal is intact. There's no exudates, no lesions, no arrhythmia. And the eyeball is intact. Now I'm going to check your eyes. Doing this, I'm going to turn off the light, okay? Ooh, too dark. Because it's going to be too dark, if I turn off the lights, I'm going to leave it on and do it. Normally, we're supposed to turn it off to check on the eyes. Okay, so I'm going to check in with the left eye. Okay. Checking the right one. Ophthalmoscope shows the red leaflets. Now I'm going to also turn off the light and have the patient on the normal one, because when I turn it off, it's too dark, so I will leave it on. I'm going to have you focus on that. Okay? And then I'm going to check, just focus on that, okay? And look at me. All right. Next, I'm going to have you close this for you. Just focus on that. Okay. And I'm going to have you follow my fingers up. Don't move your head, okay? Left superior, left lateral, left inferior. Right superior, right lateral, right inferior. Cranial nerve 3, 4, and 6 is intact, evidenced by patient being able to do the 6 cardinal fields. There is no nystagmus, there is no deviation with the cover and uncover test. And cover and uncover test, pupil is 2 mm, round, reactive to light and accommodation. Next, I'm going to inspect the ears. Inspecting the ears. The pinna is on the same level with the eye contours. There's no lesion or tenderness or mass on the pinna and the lobe. The mastoid, there's no lesion or edema or mass bilaterally. Next, I'm going to look at the ear. This is the right ear. Okay. I'm doing the left. Okay. Tympanic membrane is pearly gray. There is no, the bone is intact, there's no exudates, no deviation, there's no cerumen, there's no perforation, it's intact bilaterally. Now I'm going to have you close your right ear.
Apple?
Close your left.
Apple.
Okay. The hearing is intact, evidence by patient being able to hear apple on the right and the left ear bilateral without any problem, with 2 feet, staying 2 feet away. Now I'm going to do the Rhine and wine test. I'm going to move you this way. Sorry. Let me know when you stop hearing it, okay?
Okay. Stop. Stop.
Okay. Gonna do the left side.
Stop. Stop.
Okay. Air conduction is greater than bone conduction. By air conduction is 14, and the 14 seconds, and bone conduction is 10 seconds bilaterally. The next, I'm going to check on the nose. Change this. Inspecting the nose. Nose is midline. And left one. Okay, the nose is patent, there's no arrhythmia, no lesion, there's no polyps, it's intact bilaterally. Next, I'm going to inspect the mouth and the throat. inspecting the mouth. Okay. And I'm gonna do again. Okay. The uvula is midline, is intact. It rises with the soft palate as patient says, Open your mouth for me. The mouth is pink and moist. The tongue is appropriate size for the patient. 32 white teeth. The tonsillar is 2+/4 bilateral. No arrhythmia, no lesions or any exudates. Next, I'm going to do the sinuses. And throat is also intact as the patient is able to swallow. The next is sinus. I'm going to palpate the frontal. Can I have you turn this way? Okay. Frontal sinus is any tenderness or pain?
No.
Okay. There's no pain, there's no tenderness with the sinuses. Next, I'm going to do the sinus illumination. Normally, I will turn off the light, but it's going to be too dark if I do so. So I'm going to do the illumination. Translumination is, there's no obstruction with trans illumination. Next, I'm going to check on the chest, and I'm going to inspect the chest and record and listen anteriorly, posteriorly, and laterally. Okay? Chest movement is even bilateral. The chest elliptical moves the same. There's no deviation in chest elliptical. And respiratory rate is 16 seconds per minute. I'm going to palpate Becker's, palpating. There's no masses or lesion. Okay, Becker's-ing it, starting from the apex. Can you raise your hand for me? Okay. Resonance head on anterior, posterior, and lateral chest. Next, I'm going to listen to it. Okay. The lungs is clear to auscultation. There is no adventitious sound. Next, I'm going to do the heart. And the heart, I'm supposed to do it. The heart is done on patient sitting position, on patient when patient is supine, and on a lateral position. And before that, I'm going to listen to the trachea. Trachea expiratory rate is greater than expiratory rate, and on the right and left lung, expiratory rate equals to inspiratory rate, and on the vesical part of the lungs, inspiratory rate is greater than the expiratory rate. Now I'm inspecting the chest. There's no pulsations, no hips. I'm going to listen to it. Palpating the chest, the precordium. Palpating the apical pulse for 60 seconds. Okay, now I'm going to listen to the heart sounds. Listening to the heart sounds, I'm going to listen with the diaphragm and the bell. The diaphragm is used to listen to the high pitch sound, and the bell is used to listen to the low pitch sounds. Using the diaphragm, aortic, second intercostal space, right sternal bottom. Pulmonic, second intercostal space, left sternal bottom. And S1 is greater than S2, the same S1 is greater than S2 in the aortic. The next one, X point, third intercostal space, left sternal border. S1 and S2 is equal to S2. Tricuspid, fourth intercostal space, left sternal border. S1 is greater than S2. Mitral, fifth intercostal space, left mid-clavicular line. Here I'm going to listen to the apical pulse for 60 seconds. It's also point of maximal impulse. Apical pulse is 78. I will use the bell. Aortic, second intercostal space, right sternal border. S2 is greater than S1. Pulmonic, second intercostal space, left sternal border. S2 is greater than S1. X point, third intercostal space, left sternal border. S2 equals to S1. Tricuspid, fourth intercostal space, left sternal border. S1 is greater than S2. And then mitral, fifth intercostal space, left mid-clavicular line. S1 is greater than S2. And this is the point of maximal impulse. We have regular rate and rhythm. There's no murmurs or trills or gallops. Okay. Next, we're going to check on the abdomen. I'm going to have you lay down for me. Inspecting the abdomen. Abdomen is flat. I'm going to auscultate. Right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant, and the epigastric. Normal bowel sounds hand on the four quadrants and the epigastric. I'm going to percourse, right and lower upper quadrant, left upper and lower quadrants, and on the epigastric, I'm going to on the liver, dullness head on the liver is on the fifth intercostal space on the right sternal border, and then dullness head on the left mid-clavicular line, between 6 to 10 intercostal space. And the size of the liver, I'm gonna measure it. Size of the liver is 7 cm. Next, I'm going to do a palpation. I'm going to do light palpation and deep palpation. Okay? Let me know if there's any pain or anything, okay?
Okay.
Light palpation. Right upper quadrant. Right lower quadrant. Left upper quadrant. Left lower quadrant. And then now I'm going to do the deep palpation. Right upper quadrant, left lower quadrant. Left upper quadrant, left lower quadrant. And then the picture close. Now I'm going to check on the Murphy sign. Can you take a deep breath for me? And breathe out. Okay. There is no pain, no tenderness, and no masses. No masses here. Okay. Thank you. Can you stand up for me? Come to this side. I'm going to check the CVA while you're standing up. There's no tenderness with the CVA. Now, as you're standing up, I'm going to have you close your eyes and raise your 2 hands for me. Lumbar chest is intact, patient is not, there's no deviation. Can you walk for me a little bit? Doing the musculoskeletal, that's fine. You can come back. Patient walks straight line without any deviations or falling apart. Now we're going to do the passive and active range of motion. We're going to do the cervical. I'm going to do it with you. So I'll have you is flexion, extension, hyperextension, left lateral, right lateral. So you do it with me. Flexion, extension, hyperextension, right lateral, left lateral. Good. We're going to do the shoulders. So it's going to be flexion, extension, hyperextension, adduction, abduction, interior rotation at your back, and then raising it up, exterior rotation. Okay, let's do it together. It's flexion, extension, hyperextension, abduction, abduction, interior rotation, exterior rotation. Good job. Now we are going to do on the wrist. It's going to be flexion, extension, hyperextension, radial deviation, ulnar deviation. Okay, let's go. Flexion, extension, hyperextension, radial deviation, ulnar deviation. Good job. I'm going to have you sit and we'll do the ankles. It's going to be dorsal flexion, plantar flexion, inversion and eversion. Okay? I'm going to do that with you together. And it's going to be dorsal flexion, plantar flexion, eversion, inversion, and eversion. Good job. Okay, one more time. I'm going to have you stand up and bend down and touch your toes. Checking for sclerosis on the anterior, lateral, and posterior. I'm going to have you rise gradually, get up a little bit, stand up. Sclerosis is intact, shoulder height is intact on the same level bilateral. The hips rises bilateral on the same level. All right. Now, can you sit down for me? I'm gonna check on the blood vessels. I'm gonna check on the temporal. And I'll listen to the temporal. Okay. Brachial pulse. Radial pulse. Raise your leg for me. Dorsalis pedis and posterior tibial. Pulse is regular rate and rhythm is 2+/4 bilaterally upper and lower extremities. Next, I'm going to check on the cranial nerves. Have you had any problem with smell recently?
No.
Okay, cranial nerve 1 is olfactory, is a sensory nerve. Is intact as evidenced by patient being able to not having problem with smell. And the cranial nerve 2 is optic. We did that with the Rosenberg. Patient was able to read OD, OU, and OS was 20/20 bilateral. The next one is cranial nerve 3, 4, and 6. It was intact and it's motor. Oculomotor, trochlear, and abducens. It was intact as evidenced by patient being able to do the 6 cardinal fields, and there was no nystagmus or any deviation. Cranial nerve 5 is both sensory and motor. It is trigeminal. It has, I'm going to have you open your mouth wide, open and close it, checking on the masseter. Okay, and I'm gonna have you close your eyes and tell me if you feel any sharp or dull. Okay?
Okay. Sharp. 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 Dull. Dull.
Okay. Cranial nerve 5 is intact. My stamp patient was able to identify dull and sharp. The next cranial nerve is cranial nerve 7. It is facial and is sensory and motor. It's sensory and motor. I'm gonna, as evidence, have you had problem with taste recently?
No.
Patient is able to taste on the 2/3 of the mouth, anterior 2/3 of the mouth, and I'm gonna have you smile. Show your teeth, puff your cheeks, raise your eyebrow. Good. It's intact. Patient is able to raise eyebrows, puff cheeks, and smile and show me the teeth. The next is cranial nerve 8 is oculomotor, acoustic oculomotor. It was intact as evidenced by patients being able to identify apple on the right and the left ear bilateral. We are moving to cranial nerve 9 and 10, glossopharyngeal and vagus is sensory and motor, and is used to check. Patient is able to taste to third posterior of the mouth, and the patient was able to swallow without problem and said without any problem. And the uvula was rising. Cranial nerve 11 is motor. I'm gonna have you move, following my hand. No, like follow my hand on the first. Okay, resistance. And this one on this side. Okay, wanna shrug your shoulders. All right. Cranial nerve 11 is intact. Patient is able to, the spinal nerve and his motor nerve, patient is able to move while shrugging shoulders and on the face too. The stenomastoid is intact. Cranial nerve 12 is hypoglossal. I'm going to have you bring out your tongue for me and push it against resistance to this, okay? Okay. All right, this one. Can you do the, okay, and this one? Okay. Cranial nerve 12 is intact, is model. Hypoglossal, patient is able to move tongue. The function again helps with the swallowing. Next, I'm going to have the patient do the motion exam. I'm going to have you touch your nose and point to my finger on the right hand. Touch your nose and point my finger again. Faster, faster. Okay, do it on the left finger. Faster, faster. Okay, I'm going to have you close your eyes again and tell me if it's sharp or dull or anything, okay? Close your eyes.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay, on the lower extremity.
Sharp. Sharp. Dull.
Okay, it's intact as evidenced by patient being able to identify sharp or dull pain. Next, I'm going to do the tendon reflexes. I'm going to do the tricep. Okay. Okay. Brachioradialis. Okay. And then again, we'll do it here again. And hold it on this way for me. Okay. Okay. Next, I'm going to do the patella. Hold, put your leg down. I'm going to check it. Okay. Okay. Achilles.